Influenza is a virus, and there's two basic serotypes, type A and type B. Probably not that important to know which one is which, other than like last fall when we had the swine flu. It came out a certain serotype, and so we could do testing and determine the likelihood of swine flu even in the office at that point without having to send a sample off to the CDC or to the state health department to have that checked. But the symptoms of the flu are typically a rapid onset of fever, headache, body aches, congestion in the nose, and maybe a cough. And usually the sudden onset of the body aches and the headache with the fever are pretty good hallmarks. Now, you can have those same symptoms with other diseases, but whenever it's timed with the flu during peak flu season, which in Oklahoma ranges from about October to November through the beginning of March, with the normal true peak being in February. If you have typical flu symptoms with the sudden onset of the high fever and cough and headache and body aches during that flu season, then clinically a doctor is usually going to make the diagnosis of flu, even in the absence of a positive test. We do have rapid testing for flu that we can do in the office to help confirm, but it is not as good a test as some other of our tests like strep. It misses more cases. In fact, maybe as many as 30%. And during the swine flu epidemic last year, it was missing as much as maybe a 60 to 70%. So even though you have a negative flu test, it doesn't necessarily mean that you have the flu. And a doctor may go ahead and treat you symptomatically just based on the clinical diagnosis from that. Well, one of the primary precautions is, first of all, if you're sick, you need to stay home. You need to not be exposing other people in your workplace to the flu. So, it's important that whenever you're sick with fever, that you stay home, and that you stay home until you're fever-free for 24 hours. Because until after that point, you're still pretty contagious and are putting other people at risk. So that's the first thing. The second thing, obviously, is for everybody to wash their hands a lot. Once again, keeping your hands away from your face as much as possible, unless you've washed your hands, it will help decrease your risk of contracting the flu. And then the last thing, and probably the most important thing, is for people to get their influenza immunization and getting the shot to help prevent it. And you need to get that every year because the flu strains change. We get what's called antigenic drift within the flu virus every year, and the virus changes, and the Centers for Disease Control will evaluate the flu strains that are over in Asia, try to determine what are going to be the most common flu strains to appear in the United States, and they develop the vaccine each year specifically to go after those strains. Sometimes they do a better job of getting it, sometimes they don't. A few years ago, in 2008, they didn't do such a good job of predicting it, and we had a lot of people that even got the flu shot that still got the flu. So even the immunization itself is not 100% guarantee that you won't get the flu.